Partograph. So firstly we are going to look at the specific one, that is WHO modified partograph, that is in 2000, and here we are looking at some major points. There is no latent phase, and upon the vaginal examination this should be done with not less than every 4 hours. So it should be done every 4 hours, and to assess the cervical dilation and also the descent of fetal head, and the molding of the skull bones. More frequent examination is only undertaken if indicated. Next, the charting, it starts at 4 cm of the cervical dilation. This is when the charting starts. Now the color of the meconium, it is C for clear, it is B for blood, and it is M for the meconium stained. Now in case of molding there are various stages. Stage 0 is when the bone are separated and the sutures, they are easily felt. Now looking at 1+, here the bones are touching. In case of 2+, the bones are overlapping. And can be reduced. Here the bones are severely overlapping as well as irreducible. Next we are looking at the alert line. Alert line, it basically reflects the average rate of the cervical dilation. This is of the slowest quintile of the term primigravy. And in case the dilation slows down or ceases, so the dilation, it ceases or slows, so then the plot will cross the alert line. Next, the alert line at 4 cm dilation, and the expected dilation is about 1 cm per hour. Now what is the action line? Action line is in 2 to 4 hours after the alert line, and it prompts the interventions. So it prompts the interventions to accelerate the labor as well as the performing the cesarean delivery. So high rates of perinatal mortality are associated with the delays of 4 hours or more. So in case greater than 4 hours delay can lead to mortality in most of the cases. Contractions are measured for a span of 10 minutes. Contractions are measured for a span of 10 minutes. And the duration is seen. The measurement is done. Measurement is done every 30 minutes. And 1 square is nothing but half an hour. Then looking at the pulse is recorded every 30 minutes. And what is seen is 1 square is nothing but half an hour. The pulse is marked with a dot, and the blood pressure, if you see, blood pressure, it is recorded every 4 hours, and the mark with arrows, it's marked with arrows, and unless the patient has a hypertensive disorder or preeclampsia, in which it is recorded every 30 minutes. Every 30 minutes is done, otherwise it is recorded every 4th hourly. Next, looking at temperature. Temperature, it is recorded every 4 hours.